Hand hygiene is the best way to decrease the spread of infection. It involves the act of either washing hands with soap and water or using a hand sanitizer. Hand hygiene should be performed in the following circumstances: before putting on gloves and after taking them off, upon entering a client's room and at the end of a client contact, before going on break and after returning to the unit, before and after eating, drinking, or smoking, after using the restroom, and after touching any contaminated objects. But how do you know when to wash with soap and water and when a sanitizer is appropriate? There are certain situations in which hands must be washed. When hands are visibly soiled after using the restroom, when hands become contaminated by blood or other bodily fluids, or when caring for a client that has or is suspected to be infected with norovirus. If any of these situations apply, you must wash your hands. The supplies you'll need to perform this skill are antimicrobial soap, paper towels, and an orange stick or nail brush if necessary. To perform this skill, do the following. Remove any rings you may be wearing and, if you are wearing a watch, push it up your wrist about 2 inches. Turn on the faucet with a paper towel and check the temperature of the water with the opposite hand. Be sure the water is warm, not hot. Then discard the paper towel in the wastebasket. Wet both hands with your fingertips pointing downward and, once wet, apply a quarter-size amount of antimicrobial soap to the palm of one hand. Vigorously lather the soap in your hands for at least 20 seconds outside the stream of water. Be sure to lather up to 1 inch above your wrists, all surfaces of your hands, including the palms and tops of your hands, between your fingers and under your nails. Using an orange stick or nail brush might be necessary in this step. Rinse your hands of soap starting at the wrist, again with your fingertips pointing downward. Once rinsed, dry your hands with a clean paper towel. Use as many as is necessary to thoroughly dry both hands, and then discard the paper towel in the wastebasket. With a clean paper towel, turn off the faucet and discard the paper towel. You may apply a small amount of hand cream in order to prevent dermatitis and cracking.